Hi, this is Dr. Rajka, and we'll be reviewing tonight Understanding and Treating ADHD Naturally. Sorry if there was a glitch. The call had dropped for a short while. So let's get started. Sit back and enjoy. I have nothing to disclose for this conference call except for that I am doing some speaking for SpectraCell. To review the objectives, I'm going to define the criteria and differential diagnoses of ADHD, and then review neurotransmitters and pathways, review sources of inflammation, as well as review strategies for treating these sources of inflammation, and then it will culminate in reviewing the micronutrients that are involved in the prevention and treatment of ADHD. And to tie it all together, we'll do a case review so that all of this makes sense. Do you want the pill, the suppository, the patch, or the app? It's all too common in medicine that we're just prescribing unless you're taking a functional approach. And that's what we'll hopefully be doing today. To define ADHD, the DSM-5 established the following criteria, actually to diagnose it. It's diagnosed by having a patient have a persistent pattern of inattention and or hyperactivity for at least 6 months that interferes with functioning or development. Symptoms have to be prior to 12 years of age. So if you have an adult that presents with these symptoms of inattention, then you're not dealing with ADHD. The symptoms have to be present in 2 or more settings, so not just at school or just at home. And there has to be evidence that these symptoms interfere or reduce the quality of social or academic functioning. And the symptoms do not occur exclusively with another psychotic disorder and are not better explained by another mental health disorder. Now that we've defined the criteria that leads to the diagnosis of ADHD, let's look at some of the things that make it difficult to diagnose ADHD. There's a long laundry list of differential diagnoses, and not are these all differential diagnoses, but many of these are also comorbidities or exist with ADHD. The list includes anxiety, PTSD, depression, affective disorders such as bipolar, adjustment disorders, developmental speech and language disorders, learning disabilities such as central auditory processing disorder, epilepsy, hypothyroidism, infections including HIV, Lyme, and many others, neurofibromatosis, sleep disorders, and then heavy metal toxicities, and in children, this includes especially lead. So in order to understand ADHD, it's important to know which neurotransmitters are involved with focus and concentration. Today we're going to review briefly dopamine, which if low can lead to the inattentiveness seen in ADHD, along with norepinephrine, epinephrine, and acetylcholine. And acetylcholine is mentioned here. It's indirectly involved in the symptoms of ADHD because it can affect memory if it's low. So if you're not mentating and remembering things, then you're not going to be attentive or as focused as you might be if you were remembering commands and steps that are given to you. So for dopamine, norepinephrine, and epinephrine synthesis, we'll do a brief overview. Tyrosine, which comes from our diet, predominantly in forms of protein, goes on to become L-dopamine, then dopamine, then down through the pathway to norepinephrine, followed by epinephrine. Everything that is in darker green above the arrows that are curved, so when we look from tyrosine to L-dopamine, we see Fe, or iron, is needed. And then from L-dopa down to dopa, you need B6. And then dopamine down to norepinephrine, it's copper and PQQ. And finally, norepinephrine to epinephrine requires SAM, or S-adenosylmethionine. So to summarize these cofactors, we have B6, copper, PQQ, SAM, and actually iron was left off of this list. So if you're deficient in any of these nutrients, then you're not going to be making dopamine, norepinephrine, and epinephrine as readily. So what increases dopamine naturally? So in thinking of how we approach it, well, phenylalanine, and as we've seen in the prior pathway, tyrosine goes on to become L-dopamine that's required. Pyridoxine, or B6, vitamin B6, is one of the cofactors in that pathway. Folate, and folate indirectly, because folate is needed to fuel the methionine cycle, something we're not going to review today, but is important in methylation. And if you're not making SAM within the methionine cycle, then you're not going to be making your neurotransmitters. So you have to have sufficient folate around. And then phosphotidylserine, and we'll get to the pathway of where this comes into play, rhodiola, and curcumin. So these are some of the things you can think of when reaching to how do we treat it. But we're going to explore it in a more systematic fashion very shortly. So we'd spoken about dopamine, norepinephrine, epinephrine, and I'd mentioned that acetylcholine is important for memory. So how is acetylcholine formed? Serine goes on down to form choline through the SD, or serine decarboxylase enzyme, and then choline is converted to acetylcholine through the choline acetyltransferase enzyme, and the cofactor here is acetyl-CoA. So again, if you're deficient in any of these substrates, serine or choline, or the cofactor, you're not going to go on to make acetylcholine as readily. So again, our cofactor here is acetylcholine. I always like to know the cofactors involved, because having micronutrient deficiencies, you can act as if functionally you don't have enough of a substrate, such as acetylcholine being produced. So what increases acetylcholine? Well, the foods that are naturally high in choline will, such as meat, liver, fish, egg yolks, and dairy. A word of caution in regard to dairy. Dairy tends to be very inflammatory for a lot of these children with ADHD and their secondary comorbidities that exist with it. And then phosphatidylcholine, phosphatidylserine, huperzine A, acetylcholine, and alpha-GPC. So this is a long list, and we'll see how we apply some of these things as we go through all these systematic steps coming up shortly. So I'm going to first start with inflammation. Inflammation, as you know, is the cause of almost all symptoms and disease. And how do we target inflammation? Well, I like to use a mnemonic called STAIN to help me remember and to work through the steps of removing inflammatory triggers for my patients. The first step is for sleep and stress. The T is for toxins. A is for adverse food reactions. I is for infections. N is for nutrient deficiencies and excesses. And that last S is for sedentarism and solitude. So I didn't make this mnemonic up. It was actually taught to me by IFM, but I found that by working through these steps in a very particular order, you can bring one back into balance and eliminate most symptoms and most disease. Where do I start? I like to start with food and nutrients first. And when I approach a patient, the top two foods, as we may know, that are the most inflammatory are gluten and dairy. So, but how do we determine this? Do we test? Do we treat? Do we eliminate? Particularly in children and in someone who's chronically ill, I think it's really important to test and then confirm by eliminating. So testing through one of the specialty companies, there's many that are out there, and then confirming by eliminating and observing to see what happens with the symptoms. So not all of the food allergens found are going to be ones that need to be removed indefinitely. It may be a matter of removing them, healing the gut, and then reintroducing them. But again, gluten and dairy almost always are your most inflammatory, followed by sugar and soy. In regard to nutrient deficiencies, we could guess, but I don't recommend it. So testing, preferably through a specialty test like SpectraCell's micronutrient test, is going to be one of our best options, and you know exactly what you're dealing with. But the nutrients can also be in excess. And what do I mean by excess? Which ones are in excess? Well, sugar and processed foods such as dyes, additives, preservatives, MSG, etc. These are all inflammatory. So never think of just what's lacking, but what's found in excess. And these are all common to the standard American or SAD diet. So this is where I start. These are the top two things I do with all of my patients. I found that sometimes by removing gluten and dairy, I've seen an improvement of 60 to 70% of attention and focus. And then by adding in the nutrients, you gain another 10 to 20%. But this is what my observation after the last 4 years practicing functional medicine. Now we're going to go back to that long mnemonic of stains. We talked about foods and nutrients first. The foods is actually the A in stains. The nutrients are the N. And we're going to go back to the top. And the next order is we try to move through these steps as quickly as possible. So the first S was sleep, remember that? And we want to ensure that our patient or child is getting enough sleep. So how much sleep is needed? We all know that adults need 7 to 8 hours, some more, some less. And this table here lists how many hours are needed for children from 1 to 3 years of age on down the list to 5 to 12 years of age. So it does lessen with time. If they're sleeping enough, then I review sleep hygiene with the parent and child. You know, are they having bright lights at night? Are they gaming and doing stimulating activities? What is the routine? Is it the same every evening? Does it involve something that's calming, reading, maybe listening to music, etc.? So then if these two are in alignment and the child's sleeping enough and there's good sleep hygiene and the child's still not sleeping, or the adult, then I look at what are the orthomolecular requirements for sleep. So you want to see that the levels of serotonin, GABA, and melatonin actually go up in the evening to allow for sleep to occur, and that cortisol actually is lowered in the evening. So a lot of our stressed out, even children could be stressed out patients, will have an inverse pattern of cortisol or an inappropriate elevation of cortisol in the evening, which will make either falling asleep difficult and or lead to middle of the night awakening. So I review those, and we're going to look at some of these, discuss further how some of these are synthesis in just a minute. And then lastly, I want to make sure that there are no sleep disorders. So in children, you think about hypertrophied tonsils, and are these causing sleep apnea? So this is the first approach. So you ensure sleep's in order, and then we go to the next F, which, actually we're going to review, remember I talked about the melatonin being important for the orthomolecular approach. So I'd like to look at the pathway. How do we produce melatonin? Well, serotonin is converted to N-acetylserotonin by the AANAT, or a NOT gene. It requires a cofactor of B5 or pentathane. So I've had patients with AANAT SNPs, or genetic mutations, and they may have difficulty in forming melatonin. This N-acetylserotonin then goes on to form melatonin. And the cofactor that's required here is SAM. So again, if you don't have all the nutrients for methylation to form SAM, then you're not going to be producing melatonin. So is it a deficiency in B5 or SAM, or does the patient potentially have a SNP, a single nucleotide polymorphism or genetic mutation in that NOT gene? So these are all important to explore. It may just be, if there is that mutation in the gene, as simple as providing a very low dose of melatonin in the evening to bring them back to balance, allow them to sleep so that they can focus. Remember, I said the second requirement would be we would need GABA in the appropriate amounts. Well, how is GABA synthesized? Glutamine is actually converted to glutamate, and via the GAD gene, which is also the name of the enzyme, is converted to GABA. So glutamate goes to GABA through GAD. And the cofactors necessary here are B6 and magnesium. So if you're deficient in B6 and magnesium, you may not make this conversion. Subsequently, if you're getting high loads of glutamate, so MSG may convert to those high loads, you may not do this conversion. Excess glutamate is actually excitatory, so you don't want excess glutamate floating around. So these are the things that really need to be explored as to if the child has appropriate sleep duration and hygiene baby melatonin is being produced, then exploring what's going on with the synthesis of GABA. Now, how about serotonin synthesis? Remember I said melatonin, GABA, and serotonin, all three have to increase in the appropriate amounts. So to form serotonin, this pathway shows both serotonin and dopamine, but focus on the left side of the pathway, and starting at the top, tryptophan is converted to serotonin. You need tetrahydrobiopterin to make this conversion. And something that's inhibitory to this pathway is something called peroxynitrate. And this is something that is formed when there's excess free radicals that are not being broken down appropriately. And the nutrient needed here for this conversion is iron. So you need tetrahydrobiopterin and iron, or Fe as the abbreviation. So again, that iron deficient child, we'll see some of the studies coming up, may not focus enough, and that may be occurring because they're not producing serotonin, they're not sleeping well, etc. So those are our cofactors. These cofactors listed in this long list are for the whole pathway, but for the conversion or for the formation of serotonin, you need BH4 or tetrahydrobiopterin and iron. And what's inhibitory is peroxynitrate. I'm not certain why. Oh, it's inhibitory to the tetrahydrobiopterin, actually. That's it looks a little confusing the way it's listed. All right, so let's look at that. I said in order to mentate properly, you need dopamine, norepinephrine, epinephrine, and acetylcholine all in the right balance. And I've listed all of these cofactors that are required. And then in order for appropriate sleep to occur, you need melatonin and GABA and serotonin. So let's look at where some of the overlap is. So you need iron in both dopamine and serotonin synthesis. And then you need SAM for epinephrine and melatonin synthesis. And then you need tetrahydrobiopterin for dopamine and serotonin. The purpose of this slide was to show that many of the cofactors, which are vitamins or minerals, are overlapping. They're involved in multiple pathways. So if you're deficient in them, they can affect multiple pathways. Now, getting back to our long list of triggers, the first S was sleep. The second S is stress. So one of the stressors that goes along with having ADHD is that child is different to his peers. Maybe they're singled out. Maybe they're placed in special classrooms. Many a time, children know that maybe they're even being medicated. So this creates its own element of stress just by virtue of being different. And then I will review with the family various ways to modulate stress. So in kids, exercise is key if you can get them to exercise by finding an activity that they like because it will lower the cortisol. I also teach all of my patients heart math. Now, what's heart math? Heart math is biofeedback that uses breath to modulate the heart rate and get you into a state of coherence. And the state of coherence is one where the parasympathetic or calming nervous system has been switched on. And when you're in a parasympathetic state, you're actually best able to focus and mentate. So let's say that again. When you're in a parasympathetic or calm state, you're best able to mentate and focus. And for children, there are actually games that children can play, so it makes it easier. So these are games that are on the computer if you have the appropriate system through HeartMath. And periodically, you may need to supplement to lower that cortisol as you work on the modulation piece. So things that lower cortisol, the top two, are phosphatidylserine. And remember, serine is actually needed to create choline, and choline goes on to make acetylcholine, which is so crucial to memory. Choline also is required in the shortcut pathway of recycling homocysteine to methionine in the methylation cycle. So it's got twofold way that it helps with attention, but it also will lower cortisol and allow patients to focus. And then ashwagandha, secondly, will modulate an elevated cortisol response. Actually, it's an adaptogen. So if it's low, it'll elevate it, and if it's high, it will actually decrease it. And then T is the T in stains is for toxins. And I review with all my patients. Many of them coming in are very knowledgeable and know which foods to avoid. So I refer them to the EWG, or Environmental Working Group website. There's a listing of the top foods laden with pesticides. They call those the dirty dozen, and those that are safe to eat if you don't buy organic, or the clean 15. That list does change from time to time as to which are most toxic and which are the safest to buy inorganic. And then once we review exposures from foods, we talk about exposure from the air in the home and have them consider air filters as well as water filters, removing chlorine from their drinking water and shower water. And then the EWG site, which I don't have listed here, has a skin deep section which reviews beauty products. So even soaps and shampoos are important to know which ones are laden with xenoestrogens, or chemicals that are harmful and can act like estrogen in the body. And once we've removed or educated a patient on which toxins to avoid and how to avoid them, then I test. So you definitely want to know where is that lead level, because lead is in that differential diagnosis, and especially in young children can affect memory, focus, and mentation. And then lastly, you want to ensure that the patient with ADHD is detoxing appropriately. So remember, all of your toxins in the body are broken down through phase 1 and phase 2 detox, and your phase 1 needs plenty of B vitamins, and phase 2 for further breakdown needs amino acids, so protein, ensuring that that child's getting enough protein. Maybe they need a little support with N-acetylcysteine, and you also need glutathione. So these are all the things I explore when we're working through all the inflammatory triggers, utilizing that mnemonic I've listed as stains. We're going to jump to the I in stains because we've already talked about the A, which was for adverse food reactions, and the I stands for infection. So I test and then treat. In regard, we test the stool, looking for various dysbiosis and or overgrowth of candida or clostridia, SIBO, etc. And then testing through blood for Lyme, HIV, EBV, or CMV. And then when you're thinking about this, you say, well, how can an infectious process lead to inattention or hyperactivity? Well, Clostridia actually produces a metabolite known as HPA, which is very excitatory. So, and it leads to super high levels of dopamine, which can render a child hyperactive and aggressive. So if you remove the Clostridia and remove this metabolite, then you would see a decrease in this hyperactivity and aggression. Okay, the last two S's in stains are for sedentarism and solitude. In regard to sedentarism, it seems to be all too common in children. How many of you know children, whether they're your own or even friends or family members, that like to sit around? Well, you have to ask yourself, are they sitting around because that's what they've been conditioned to do and they want to stay indoors and play video games? Or is it because they have low muscle tone? So if you're not taking in enough protein, you want to make sure that they're taking enough protein for good muscle tone, and that they're actually producing enough creatine, and that is produced in the methylation cycle, the methionine cycle. So are they sedentary because they just are conditioned to, or do they have inadequate muscle tone due to low protein intake or low creatine levels? So these are things that need to be explored to figure out why. And again, to revamp and to hit the point home, why is that exercise important? Because it'll increase the serotonin, and that'll lead to your good sleep and mood, and therefore focus. Exercise also increases something called BDNF, or brain-derived neurotropic factor, which is important for the neuroplasticity of your brain and making new neurons, as well as increasing mitochondria, which is the energy center of our cells, as you know. And when you're energetic and are thriving, you're more apt to focus. This leads us to the last S in stains, which is solitude. So again, this can be an inflammatory trigger, and if a child is different, they can or will be the outsider, is to find support groups, so finding like children, and then also sampling the child in different activities, not only to make them less sedentary and finding an activity they like, but then to find children that they are like-minded with and can bond with, so that this element of solitude doesn't exist. All right, we've gone over the inflammatory triggers we look at, and one of those was nutrient deficiencies. We're going to look at what do the studies show, okay, in regard to ADHD and magnesium first. Well, magnesium, as we know, is involved in over 200 enzymatic processes, and the studies have shown that 96% of children with ADHD were deficient. And by replacing them, hyperactivity was noted to become 90% less, with an improvement of inattentiveness by 66%. And you want to give magnesium with B6. And remember, B6 and magnesium were the cofactor for the conversion of glutamate to GABA. And GABA is our calming neurotransmitter. If you're very anxious, you're not going to focus. And GABA is necessary for sleep. So if you're sleep deprived, you're also not going to focus. What else did the studies show? Well, they found that lithium, as in the mineral lithium, not the medication lithium, is beneficial for the irritable, angry, aggressive, and impulsive child. And they were also noted that low levels in an area's water supply led to higher rates of mental and emotional disorders. And lithium, the mineral, was actually twice as potent for Ritalin for aggression, and it increases serotonin, dopamine, and MAO, as well as decreasing glutamate. And glutamate, remember, is excitatory to the brain and can lead to aggressive behavior and hyperactivity. Another micronutrient important for in ADHD is iron. So iron was an important cofactor we saw in several of the biochemical pathways, and studies have shown that iron deficient children scored poorly on math and language tests, and that iron deficiency actually can aggravate these symptoms of ADHD, as well as increase the child's risk of developing ADHD. So that is a simple test that looking at iron studies and or ferritin levels to check iron stores in the body. And they're finding out why they're deficient, is it dietary or otherwise, and they're treating accordingly. All right, moving on to zinc. So another micronutrient found to be important within ADHD. And zinc is actually a cofactor in many chemical pathways within the methylation cycle. But what we're typically seeing is an imbalance of zinc to copper in these children with ADHD, meaning that the copper is much higher than the zinc. Typically should be seen in a ratio of 1:1. It's important for the formation of dopamine, serotonin, and norepinephrine, and it actually protects our neurons against oxidative damage. Severe deficiencies were seen in 30% of children with ADHD. And those ADHD children that had the lowest levels of zinc demonstrated the highest levels of inattention, impulsivity, anxiety, and hyperactivity. And lastly, really important to note is the lower the level, the less effective the stimulant drug was. So if you get to the point of needing a stimulant drug and then it doesn't work in a child, then you have to say, is it because their zinc is too low, or is that just an ineffective medication for that particular patient? What was seen with omega-3s in ADHD? Well, we know that 60% of the brain is made of fat, and children with ADHD, not only do they have lower levels of many of these other nutrients, but they have lower levels of omega-3s. And actually eating less omega-3 fatty acids increased a child's risk for developing ADHD, while supplementing led to less inattention, less hyperactivity, better memory, better spelling, and better reading ability. But this takes time, so it took about 6 months to see an improvement in symptoms in these studies. We had talked about infectious processes being one of the triggers, inflammatory triggers, and how to investigate. one of the studies done looked at probiotics and ADHD. Well, probiotics actually manufacture our essential fatty acids and are important for B vitamins and K vitamin formation. And they also boost our absorption of vitamins and minerals. So having the appropriate microbiome is important for not only manufacturing of some of these nutrients, but also absorbing them. And it was shown that probiotics worked as well as Ritalin when taken with other supplements. Now, one study showed 3 days of probiotics increased problem-solving ability. Ticagrelor is another nutrient, supplement that has been studied in ADHD. Pine bark extract is the best studied OPC, which is ticagrelor is one form of OPC for ADHD. But there are many available, such as green tea extract, blueberry extract, and grape extract, and even a 1 ounce portion or serving of 60% or higher dark chocolate. So interestingly enough, I had a mom say, oh, I give my son a little dark chocolate in the morning and he seems to focus better. So this is a child who had ADHD and autism as well. And the chocolate actually is one of the OPCs. So the mechanism is not certain as to why this works, but after a month of supplementation with ticagrelor, we noted in the study improved focus, concentration, and hyperactivity. Now, this is not one of the nutrients or not a supplement, but neurofeedback, which is a modality, in 2012 was listed by the American Academy of Pediatrics as effective as medication. So that's right, neurofeedback, which is a modality that causes no harm, was as effective as medication in treating ADHD. Now, how does this work? So an ADHD child has many theta waves, which leads to being inattentive, versus beta waves, which is attentive. So think of neurofeedback as biofeedback. So it retrains one's ability to alter the brain leading to having more beta waves so they can become attentive. And the effects were long-lasting. One of the drawbacks is it can be expensive and require multiple sessions, but the expense should be weighed against the benefit of that it's not short-lived and that the effect can be long-lived beyond the time of when you stop the session. So let's put it all together. So we've just kind of to summarize before we dive into this case, we've looked at the inflammatory triggers that can lead to inattentiveness and hyperactivity, and that was remembered by the mnemonic STAINS, S-T-A-I-N-S, with the first S being for sleep and stress, C for toxins, A for adverse food reactions, I for infections, N for nutrients, and then the last S for sedentarism and solitude, starting with foods and nutrients first, and then working on down the list. And then we reviewed some of the biochemical pathways, noting that there are multiple micronutrients needed as cofactors for these pathways for dopamine, norepinephrine, epinephrine, and acetylcholine synthesis. We reviewed some of the chemical components needed for sleep, such as melatonin, serotonin, GABA, and having lowered cortisol. And then lastly, we looked to the data. What was important? What is needed? And highlighted things such as magnesium, lithium, omega-3s, iron, probiotics, and even neurofeedback all had an important role to play. All right, so we're going to start with this case. The little girl, E.N., she was 2 years and 10 months old when she first came to see me for a routine physical. She had a receptive speech delay. She was hyperactive and inattentive at school, a very finicky eater, and physically very active. So we know she's physically active. So what do you think about her muscle tone here? She probably has good muscle tone, and she's probably producing creatine. In regard to her social history, she lived in New England in a home built in 1924 with an older sibling. The sibling was neurotypical, and she lives with her parents, and she sleeps well. So what's important about a home being built in 1924 in New England? So for those of you who have never lived there, many of the homes still have lead paint in them if they're older homes, and they have not been revamped. So that's important to know in this history. Family history revealed that she had a cousin with a vaccine reaction, as well as a diagnosis of autism. Subsequently, my patient's mom was reluctant to vaccinate her child further. And we don't have a lot of time today, but adverse vaccine reactions have been associated with a SNP, or a single nucleotide polymorphism, in the HLA-DRB1. That's the HLA-DRB1 gene. So if you have a mutation, you have an increased risk of adverse vaccine reactions. When I did her exam, she was very hyperactive. She had really inappropriate behavior. She wasn't interacting well, and very incomprehensible speech. The plan at this time was to check labs to include vitamin D and lead. Patient had actually had a baseline set of labs that were all normal, real recent to this appointment. And I told Mom, let's get her on some of the key things. I put her on a multivitamin with multimineral. Again, we're going to touch upon, by prescribing this, some of the nutrients that we discussed leading up to this, zinc, magnesium, etc. Advised Mom to utilize some fish oil, and placed her on probiotics. And I also referred her for a hearing test because despite having a speech delay, she had never had a hearing test. In the first follow-up, she came back. A hearing test was normal. Mom was ready now at this point to test further, but she had not started any of the supplements or made any dietary changes yet. So at this point, I recommended food sensitivity testing, and then to also do a gluten and dairy-free trial while we awaited test results. We did some micronutrient testing. She had an MTHFR test, and I looked at her urinary organic acid. In her second follow-up, the patient was already by then, and this is key when you're treating patients clinically, is there's no harm in starting an elimination diet with the top food items while you wait the results, because if you don't do so, and if you have a patient that's motivated, you lose time. So right now we didn't lose that 3 to 4 weeks between appointments, and she had an improvement. Both the parents and teacher noted she was much calmer and much more attentive with just diet alone at this point. And again, no supplementation was started. Sometimes parents are reluctant. They want to know exactly what's going on. The oat testing that we had done, the organic acid testing, had not come back yet. Her ferritin was low at 26. Vitamin D was just a little suboptimal at 47. And indeed, she actually did have a severe dairy allergy and only a mild wheat allergy on food sensitivity testing. Her lead testing revealed levels less than 3. Zinc was low at 63. And her, ironically, even though she was very, very active, her creatine was low at 0.54, and her total protein was low normal. She also happened to be heterozygous for MTHFR. So again, I reiterated some of the prior plan. We did a multivitamin mineral, added in fish oil, supplemented with iron, added a little bit of vitamin D, and then to heal her gut, as we removed some of these triggers, I added glutamine cautiously, and interestingly enough, this child was able to convert it, did not make her more anxious. Remember, if glutamine, which converts to glutamate, is in excess, you'll get hyperactivity and or anxiety. And then I asked that they change this child's probiotic from an over-the-counter probiotic to more of a nutraceutical grade product, titrating up that dose. And then I added methylcobalamin to start and titrating her up to just 500 micrograms. And I believe her multivitamin mineral had a little methylated B12 and folate both. And I advised Mom on increasing her dietary protein intake, providing her with protein at every meal as she was able to. Typically, all these patients in our offices are advised to see nutrition, and most of them do proceed. I think in this case, Mom was able to successfully implement all of these measures, and I don't believe saw nutrition. So for the third follow-up, The O testing was back, and this is what we reviewed, and this is what it revealed. She had high yeast markers, and that was noted by elevated levels of citramalic, tartaric, and arabinose, as well as carboxycitrate. She had some mild bacterial markers, and her oxalates were through the roof at 343. Her vitamin C, I think this is micronutrient testing too that had come back, was low, along with B2. And then her orotic acid, which is a marker for ammonia, was really high, 2.9, and 3 was worrisome for a genetic urea acid cycle disorder. But at this point, to remedy those oxalates, she was placed on a low oxalate diet. I gave Mom options to target the yeast, and together we opted to utilize nystatin. She was put on nystatin for 6 months. Remember, it's not absorbed, so not a bad choice if cost is a concern and or if you're worried about side effects. Her vitamin C and B2 were replaced, and she was given calcium magnesium citrate at every meal to help bind those oxalates. And then we had her continue that higher dose. Actually, I think at that point I took her dose of high probiotic even a little higher. She continued being gluten dairy free and continued the prior supplements of the multivitamin mineral, fish oil, omega fish oil, and vitamin D at a low level. She was also referred to an academic center to exclude a urea acid cycle disorder because that orotic acid, which is a reflection of ammonia, was quite high. The fourth follow-up, she was pretty neurotypical. She actually looked like a completely different child. They had waited about a year and a half from the initial visit, so maybe a year from this visit. Her behavior and attention was much improved on the regimen. And when I asked Mom, what did you think helped the most? And she really thought it was a gluten and dairy-free diet. And then after nystatin, so remember, if the gut is off, the brain is off. And so that's what led to resolution of most of her symptoms. But I think it was a comprehensive approach, looking and removing all those inflammatory triggers. And at this point, Mom had discontinued the calcium magnesium citrate. We did not do a follow-up OAT test, so I always offer to patients, do we follow them clinically or follow up with testing? Certainly, if they let me test, I'd love to confirm that we've had clearance, but at this juncture, cost was a concern. We had resolution of symptoms, and the child was doing absolutely beautifully, so we did not do follow-up testing at this point. So thanks very much. It was such an honor and a privilege to speak on SpectraCell's behalf on treating ADHD. Naturally, those are my contact details should you ever want to reach out. I'm also found, I have a website, and I'm found throughout social media, with Facebook and Twitter being my top 2 favorite places to live.